Hey, med school made easy. This is an often tested subject, not very frequently seen unless you work a lot with kids or kids of Asian descent. We're going to talk about Kawasaki's disease. This is a disease of unknown etiology. It seems like it's some autoimmune disorder in those who are genetically predisposed. In any case, it's hard to memorize all the different factoids about it. It's usually really easily treated. But in any case, we're going to get to this mnemonic. And the mnemonic is, I'm going to change colors. Crash and burn. Okay, so this is typically an illness that affects kids less than 5 years old. It's usually characterized by a fever that lasts and won't break for at least 5 days, and then it's kind of a diagnosis of exclusion. There's not really a good serologic study or other study for it. So first, this mnemonic C, crash, is a conjunctivitis. Usually this affects both eyes, can be very irritating. Conjunctivitis, inflammation of the conjunctiva of the white of the eye, can be very, really bothersome for the patient. Next is a rash. This is a maculopapular rash that will usually be on the trunk and occurs pretty early in the disease process. If you ever get a maculopapular rash in the trunk in a kid who is febrile, you gotta be thinking Kawasaki's disease, especially for testing purposes. A is for adenopathy. Like many infections or inflammatory diseases, adenopathy, especially in the cervical region, will affect almost every one of these kiddos. Next is a strawberry tongue. That's that enlarged, beefy red tongue that has a characteristic appearance. Next is H, and this is hands. It's actually hands, but I want you to think hands and soles. They get this very painful erythema to the hands and soles. And interestingly, eventually, usually if this occurs, it will desquamate, meaning it will shed the skin. And that's actually a good sign, because usually the disease recovers, or the patient recovers, right after that desquamation occurs. And then burn is too easy, because burn is burn. And that's just to remind you that these patients are going to have a fever that burns and burns for more than 5 days, which is really when you start thinking about Kawasaki's disease and ruling it out the other common causes of fever. Why is this bad? Really, the way this can get bad for a patient is if they develop coronary artery aneurysms, and that's when it can become life-threatening. So a lot of these patients will get echocardiograms or ultrasounds of their heart to rule that out or in and treat it appropriately. Another interesting tidbit about Kawasaki's disease is this is one of the few times that a medical professional will tell a mother or father, or they'll even prescribe aspirin for a kid. Usually we don't give aspirin to children, but this is one of the few times. It's actually one of the first line treatments. So you give these patients aspirin and IVIG, and you treat them with supportive care, and usually they resolve on their own. Make sure they don't have a big coronary artery aneurysm, and they'll probably be okay. All right, crash and burn, that's the mnemonic for Kawasaki's disease. Conjunctivitis, rash on their trunk, adenopathy in their neck, strawberry tongue, and hands and soles will get red and painful. And then obviously a fever that goes on for 5 days. Thanks.